when you first open up Table, or like anytime that you open up the home menu, you're greeted with this kind of view. And so the case library is located right here with the case library. If you go to that, then you will be able to see all of the different cases that we have in our table. So Anatomage, we have about a little over 1,500 CT and MRI scans in our case library. So we divided it up into these different tabs. So the first one, you can always sort by region, just by like head and neck, thorax, abdomen, pelvis, etc. So you can view all of the cases that are relevant to that region. And we also have different specialties as well. So you can sort by cardiology cases, neurology cases, etc. We also have segmentation. So the segmentation tab contains cases that are segmented out. So what that means exactly is that our modeling team helped create these models for each of these cases. So you can actually toggle on and off specific structures in each of these cases, similar to how in the gross anatomy tab with our cadavers, you can toggle on and off specific structures. So we have those located here in segmentation. And we also have other tab for anything that doesn't quite fit in the other ones. So here we have many animal scans for those of you in pre-vet or veterinary programs. We have many over here. So we have like a segmented dog and a segmented cat, and a lot of sharks were added in our last update. We also have archaeological scans as well with many mummies. And we have 4D scans, so you can see things moving in real time. So for example, we have like blood coursing through the brain over here, and we have like a beating heart, and like the breathing lungs and for the embryo, all of that. And we also have comparison cases. So what these are is that we have some default ones that we created at Anatomage in your table. So these ones will have like 3 cases laid out side by side. And they'll be synced up, and you can compare and see how these different cases compare to one another. You can also select a custom comparison case. So what this is that you can choose 3 of your own cases to compare side by side. So within each of these regions, or like any of these tabs really, you can further sort the cases by either MRI scans or CT scans. So down here on the bottom, you can click on MRI. And then if you do that, then it will make it so only the MRI scans will show up. And you could also sort by CT scans so that only the CT scans will pop up. And if you know exactly which case you are looking for, you can also go to the search bar down here on the bottom and like input in the specific cases, case number that you want. So like, for example, you can just type that in and it'll bring up everything with like a 47 in it. If you're also not sure exactly what you are looking for, but you want, you have like a vague idea, like you say, oh, I want to just find like a gunshot wound or something like that, then you could just type in that word and then see whatever will pop up with that exact string of letters. So if you type in gunshot, then this will make it so that every single case with the word gunshot in it will appear. So you can explore all of those. And with every single table on the desktop, there should be a case library list and a case library description PDF file. So the case library list will be just literally a full list of the case numbers and titles of each of the cases in our case library. And the case description PDF will have the description of each of these cases located on it. So if you're at your table, then you could go and like look at the case library list and see which case names happen to like pop out at you. And once you find a name that you particularly like, then you could go to the case library description PDF, search for that case, and then read the description. Or you can, again, bring it back here to the case library, put in the case number into this search function, and then open it up so you can look at it yourself. And so we also have, to help you get started, this folders function. So down here in the corner next to the search bar, we have folders. Within folders, you'll see 3 purple folders. And so those are like our default Anatomage folders. It goes by recently viewed, which will, of course, have all the cases that you most recently viewed. And it will have also recently added, which has all of the latest case library cases that were added to our table. And we also have Anatomage favorites, where if you insert that, oops, 1 second. Okay, there we go. If you go into like Anatomage favorites, then it will have all of our personal favorites here at the office, just a bunch of cases that we found particularly interesting or that our customers have also found particularly interesting and have used in their classes. And you can also create your own folders so that you can find the cases that you like and save them for later. So to do that, you will go down here to this little plus sign over the folder. If you click on that, then you can create a new folder, name it whatever you want. So I'll name this UGM 2021, create. And then so now you have a personal folder. So what you can do with this folder is if you find any case that you like or you find interesting, then you can select it. And then down here, there's this little plus sign. If you click on that, it will ask you to add the case to a specific folder. And you just select OK. And if you go back to the folder, then it will have the case listed out for you. So if you do that a couple more times, then you can have like this whole list in your folder. And so once you have your folder, then you can actually export it out and import it back into the table. That way you can always save it for future reference. So if you export it out, then it will save as a TXT file. You can name it whatever you want, library folder. Click on save. And then so now your folder is saved. So that way, if anybody comes in here and rearranges your cases, deletes some cases from your folder or deletes your folder entirely, you can always import it back in and it will save all the cases for you. So as a demonstration, down here in the corner, we have this little X sign over the folder. If you click on that, then it will ask you if you want to remove this folder. And you can see now that folder is gone. We have deleted it entirely. So luckily we saved our folder earlier. So next to the little plus folder, we have this little down arrow. If you click on that, you can import back in the file that you just exported out. So we have our library folder right here. You want to open that. And you can see UGM 2021, that folder has now returned with all the cases that we have previously saved. And once you have that, or like if you have like any folder, you can actually rename it as well. If you decide you don't like this name anymore or it's no longer relevant. Then right here, there's a little T over the folder. If you click on that, you can rename the folder to something else. So you change it up. Okay. And so now for the actual case library features. So we opened up a case here earlier. I went ahead and opened up case number 74. I think it was 748, sorry. There we go. So we opened up this case. And then so once you do, this will be like the automatic kind of default view that you see. And so you want to use these slider bars down here on the bottom. They'll work similarly to how they work in gross anatomy. The top one will adjust brightness settings so you can see more of the scan. And the bottom one will adjust contrast settings so you can see things a little bit more clearly. And you can still do like clipping tool. So you can see we're still clipping through the cadaver or the CT scan. And still the same as it was in gross anatomy, you can use the slider bar to adjust where the clipping plane is being applied. So you can actually use this to like create your own presets. So you can still create presets. So let's say I want to keep this kind of view. And then I might want to like just turn it around, adjust the brightness a little bit, decrease the contrast so I can see more. And then save that as like another preset. And within the preset menu, you can actually play that back. So if you open it up, at the very top, you see this little film strip. If you click on that, that'll bring up the playback function. So if you just play it, then it will actually play through each of the presets that you had created and move the scan around to like make them match. So you can use this to create your own videos in your lectures. If you wanted to just demonstrate to students how the aneurysm like looks or anything like that. And you can also create your own annotations. So next to the presets menu over here, we have this little annotations icon. If you click on that, then that will allow you to bring up the annotations. You can create different groups of annotations just to categorize what you are going to be annotating. So GM, save, and then you can add the actual annotation by going to create new. And you can say aneurysm, save. And then it will prompt you to select the location. You select the location just by clicking on the scan, and then it will have that annotation for you. And then if you're familiar with the annotations in gross anatomy, it works the exact same way here. You can toggle them on and off. And you can also export out the annotations with the little up arrow and then import them back in, as well as restore everything back to the default annotations. And so with this view, it might not necessarily be the best to view what you are trying to see. So like, for example, this is an abdominal aortic aneurysm scan. It's a little bit hard to see the aneurysm. You can always adjust the rendering of this window. So this eye icon down here, this is now our volume rendering window. So in gross anatomy, this is where you would like toggle on and off different structures and like be able to see things a little bit differently. But here it will just it will have like different filters to better view different kind of tissues and etc. So this opaque hard tissue, that's just the default one that each of these scans like tends to pop up in. And then we also have transparent hard tissue, which is pretty nice to view harder structures like the bones. And then we also have the X-ray view, so also good for things that will pop up very clearly in radiographs. And transparent soft tissue. This one's particularly good for like viewing soft tissues like the lungs. And transparent soft and hard, which is pretty good for viewing the hard tissues, but with more of a context of the soft tissues. So you can see things, how they relate to one another, like with the skin on and everything. You can see right there. And opaque soft and hard, and opaque soft tissue. This one's particularly good if you have a clipping plane applied. And we also have grayscale, which is good for viewing the bones, as well as in some cases, the blood vessels. And we also have the UHQ rendering next to that. So the UHQ rendering, that stands for ultra high quality rendering. So if you select any of these, then it will turn the scan into something very high quality, something a little bit sharper than just this regular volume rendering window. So you can still like adjust the brightness and the contrast settings here. You can see the structures tend to look like a little bit sharper. And we'll get rid of this clipping plane. So if you really wanted to get a good view of this aneurysm, then you could adjust this the ultra high quality rendering. And so we have several different options for this UHQ rendering. They mostly like differentiate between being able to see hard tissues very well and soft tissues very well. But as with most of these rendering filters, it'll be probably best to just like play around and see exactly what view you would prefer the most. And then, as always, whenever you find a view that you really like, you can go and save it as a specific preset. That way you don't lose your work. So you'll notice that when we move around this UHQ scan, it gets a little bit fuzzy. That's totally normal. That's just to make sure that the software doesn't overwork itself, trying to keep it nice and pretty for you. It will go back to normal once you stop moving it. So if we go back to our scan, we can go and view this also. There's this layout menu over here. And we can go into a 3D, 2D layout. What that will do is put the 3D scan on the left-hand side, and then put the 2D CT scan slice on the right side. So similar to how it was in gross anatomy, you can see that there is an orange plane right here, and then that will move as you move through these slices to just show you where you are. And then you can also adjust which view we're looking at over here, just like that. And on the CT side, on the 2D side, we also have brightness and contrast slider bars here as well, so you can adjust those. And then next to that, we have several different filters that you can also go through in order to best view certain elements of the scan. So like the very top one here has a brain slice. That one's really good for viewing the brain. And like this one in the middle, that one's really good for viewing the bones. So you can play around with those. And so we have this aneurysm. Any information that we have on these cases, they will be located in this eye. So we have this. So Hiba asked, can we color the aneurysm? There is no way to exactly color the aneurysm. You can draw on it using the pen tool. So you can outline something, or you can annotate it in order to mark it a little bit better. We do have many new ultra high quality rendering filters that will in our table update. So for table 8, we do have several really pretty UHQ renderings. So once those come out, then I highly encourage you to take a look at those, because those ones will color them. I've seen them with purple hues and blue hues, all of that. So we have this aortic aneurysm. And anything that we have available, all the information that we have available, it will be in this little eye menu over here. So what you can do with your students is you can pull this up. You can give them the patient history. like as much information as you want, depending maybe on their like skill level. So for like maybe more college undergraduates or like high school students, you would want to just walk them through this entire case. Whereas for maybe like medical school students, you probably would want to just give them like the basic history and tell them to figure out like what's wrong with the patient. So you can let them know that a female in her late 30s was presented to the ED. She had abdominal pain and a history of alcohol, tobacco, and recreational drug use. And then you can tell the students to find, like measure out the aortic aneurysm, find the aneurysm, and also these other things that the radiologist found, which is a fatty liver and some splenic cysts, as well as evidence of previous spinal surgery. So we can walk through that right now. You can let your students know. You can open the scan, go to the 2D, and then try to find all these different pathologies that was previously found. So I think number one, you can definitely see evidence of that aortic aneurysm right there. You can adjust the brightness a little bit and tell your students to maybe annotate it or like outline it, mark it out, and perhaps like take a screenshot of it as evidence of their findings. So you say, okay, check number one, we found our aortic aneurysm. Okay, next we want to try to find the fatty liver or like evidence of the fatty liver. So what we will do here is we can change the layout of it so we can better view the liver. So you can go over here, go into like this axial view, adjust it and like move the slider bar until we are able to, see, the liver. Here we go. And so at this brightness contrast setting, it's a little bit hard to see, like we're not really sure exactly what we're looking at. So you can go into this, into our like predetermined filters, and then pick one that is more suited for viewing the liver. In this case, the very bottom one over here, that one, it has some predetermined settings that make it particularly easy to see a contrast within the liver. So like once you pull this up for the students, you can let them know, hey, like look at this like liver, it's like pretty dark compared to all of the hepatic vessels that are within it. And then so like you ask them like, okay, like what does that mean exactly? That means that it has a lower like Hounsfield unit. So it's less dense than like the hepatic vessels that are within it. And then you ask, okay, like what else does that mean? And then so you go like, okay, well that could be indicative of, of a lot of fat deposit like being like here in the liver. So you can like ask them questions like that, walk them through it, and then have them like take the pictures, take the screenshots, mark it down, and present that, like turn that in. So like you find the liver, you go like, okay, this liver like looks really weird. And then you can move on to the next thing that the radiologist found, which is the splenic cyst. So you can already see like evidence of a cyst over here. And if you go like to the coronal view, then you can see there's like a bit more evidence over there. And then of course you can adjust the brightness contrast or adjust like the filters, see which ones might be a little bit better for viewing this like the cyst over here. And then again, take a picture, show it off, let people know. And the last thing that we wanted to find was the previous evidence of spinal surgery. So then you can ask students to like find that out. And what a person might do is they go into this layout, they go into like a sagittal view. And then with this sagittal view, then you can definitely see the bones a little bit better. And you can adjust, again, the brightness contrast settings. The one in the middle is really good for viewing bones. So if you click on that, then you can really see the evidence of the previous spinal surgery, like the medical device that was placed there. You can really see it shine in the scan. And then so Therese asked, are students allowed to access the case study library as well? That depends entirely on you. Yes, I would say if they have access to the table, if they have access to this main menu, then yes, they can open up the case library and see any of these cases that you want them to see. Like other than that, you could always do a feature lock. And if you're not familiar with the feature lock feature, then it's just over here in the settings. And so what that will do, it will lock the table so that the students can only do what you want them to do. So if you only wanted them to view one scan, and you only wanted them to like be able to like move it around, like move the image around and adjust it with the slider bars or something, then you can lock it to this one case. But other than that, if the student can see the case library, then they can access the case library. So free to use. And so next, we found this spinal, like evidence of spinal surgery. And now we can probably move on to the 3D, 2D view in order to like really compare, how it looks on the 3D side to the 2D side. And the last thing that the radiologist mentioned in her report over here is that it measured 7 centimeters at its greatest anterior posterior diameter, as well as 7 centimeters transversely. So we can measure that out. So it probably would be easiest to, adjust the brightness a little bit so we can really see this giant aneurysm. And then we can do clipping. Look at it from the side, adjust it so we can really cut in there. And you can even go over here on the 2D side to the layout. At the very top, there is a scalpel. And again, that will align the 2D slice to the clipping plane. So you have that. And now we can really measure the diameter of this aneurysm. So if you go to the ruler down here and you click on the ruler, you can select 2 points. And you can see that, yes, this aneurysm is about 7 centimeters in diameter. And then you can also adjust it. So you can look at it coronally. Here we go. Adjust the brightness a little bit. And then you can measure the diameter there. You see again, about 7 centimeters. You can go back over here and delete all of those. Okay. And then after that, like depending on the your students, then you can ask them, okay, like what would you do? Like what's your recommended like treatment plan? And so another thing that you can do with Case Library to help walk your students through it a little bit more, something that's a little bit more guided and a little bit more formal, is if you go into the Case Library under Specialty, in the bottom right-hand corner, we have the skull. That's our radiology section. So anything with a star on it has a radiology report assigned to it. So what this is that specifically we had a radiologist look at these scans, look at these cases and annotate it for us and like mark down just like anything that they saw with the case and explained the reasoning behind it a little bit and like marked it all down. So these cases, I think, are very guided and would be really helpful for teaching students like how to initially read radiographs. So we're in this section. I wanted to look for case number 2507. I can use the search bar function for that. And then I found it. We can open it up. And then for a second. And then so once you have it open, then you'll notice that this is slightly different from the regular case library scans. We have this little dialog box like in the corner, and it has like several different titles associated with it. So if you like click on one of them, then you'll see that it will jump to a specific preset with a bunch of different annotations pointing out everything that the radiologist saw, as well as have like this big info box over here that explains exactly what it is. So thoracic aorta is in the red, you know, and it also like points out the aortic stent and what we are exactly looking for. And then for those of you that might be a little bit more radiologically savvy than I am, you will notice that it is a little bit off here, but don't worry, on your tables in the 2D, in the 2-monitor view, it will be accurate. So if you like go through it, then you can have your students like go through each of these presets and really learn, you know, how to find like symptoms of atherosclerosis, or, you know, like what is the effect of the aortic aneurysm, like how did it affect the kidney? So you see here that the left kidney became slightly atrophic. And then so it explains over here on the right-hand side exactly what happened there, and like, you know, how we viewed that. And so the very last one over here, axial views of the aortic aneurysm, it just has like a slightly different view of the aneurysm that you could also show to your students. So each of these radiology reports, every single case in our radiology section will have these kind of presets and information assigned to it. And you are also not entirely limited to these presets as well. You can always adjust them on your own. So you can actually, you know, still move the 3D side as well. If you notice anything like a little bit off or something, you can, you know, like move the arrows around as well, adjust the brightness and the contrast settings, and apply different kinds of filters. You can still do all of that. And you can still save them as presets. So you are not limited. You can still, you know, show off the things that you want to do. And in fact, some of these radiology reports, they do in fact have like extra information in them saying, adjust the slider bars to like properly view this one thing. So, you know, still highly encourage students to, like, when they see these, to see if they can find anything on their own, or if they wanted to like have like a slightly different view, if they're a little bit confused, they can still adjust it. Like, see over here, now we can really see the aortic stent graft. And then, so next, you can also actually open up your own file. So if you go to open file, then you can actually import in your own DICOM files and like view your own CT scans in the table. So if you go to like browse, then you can import in any like compatible file. I'm going to open up this scan that we have. And then you can view this with the same kind of filter and brightness settings as, you know, as everything in our case library. So if you adjust the brightness and the contrast, you can't really see much because this we want to see the coronavirus. This is a coronavirus scan. So maybe we want to go to the visibility, see some transparent soft tissue. And then so now that we're here, we can definitely see some like the coronavirus scan, and we can really see, you know, how the coronavirus has affected this patient's lungs. So this is actually, the coronavirus scan is included in our 703 update already. So if you have that update, then it's case number 7200. And it will definitely be included in our table 8 update as well. But you can definitely see like the classic, like kind of glassy look of the coronavirus here. So you can still clip through them, create your own presets, annotate everything, do measurements, all of that. And so the last thing that I wanted to point out for everybody using the table is that the case library, we also have case library linking. So if you go into this layouts menu over here, Then in the middle, or like in the middle over here, we have this histology slide. If you click on that, then it will put the cadaver into a linking kind of view. So it will split the screen into two. And then down here on the bottom, we have this CT image down here. If you click on that, then it will link the case library to the cadaver. So if you click anything on the cadaver, then it will bring up all the relevant cases, basically. So I clicked on the frontal bone here. It brought up a lot of skull scans over here, like that. And similar to the case library, you can still adjust the brightness and contrast settings. And there's this eye on this side as well. If you click on that, then you can still adjust the volume rendering of it so you can view different tissues a little bit better. And you are not limited to just like, you know, trying to find a structure that's like relevant to maybe a case that you like wanted to find. You're not limited to that. You can also go down here to the slides, the stacked slides. And if you click on that, then you can open up the case library and pull up specifically the cases that you wanted. So for example, if we want to see maybe our aortic like aneurysm side by side with our female Asian cadaver, and you know, compare, you know, their like aortas and see like, okay, like hers is like pretty normal compared to like this case, then you can actually like pull that specific case up, click on it, open it up, adjust the brightness and contrast. Yeah. And then you can like change the view on the 3D side over here, go to the eye, you know, turn everything off and maybe just turn on a specific cardiovascular structures. So just like the great vessels. Zoom in a little bit and, you know, like highlight the aorta, for example. And so you can show this to your students. You can save this as a preset. And then have that available for your students, like ready to go to like kind of compare the two. Okay. And so that is everything within our case that is relevant to our case library. The very last thing is that this eye icon is also available. So if you happen to like jump upon a case that you're not familiar with and you would like to know more information about it, this eye icon over here, that one will bring up all the information that we have available. Maybe if we can open up a new one, I have all the information that we have available. And so you can actually see, you know, the case number and all the information that we have. And so you can easily find it later on in the future.